Hello there, how are you? I hope you are in fine cheers and in great health. Recently, we have been treating many patients suffering from viral fever. We thought that it is necessary for the people who can't come to us know about viral fever, its effects, remedies, and how to prevent oneself from it. During the monsoons, viral infections are quite common and they spread very quickly. People generally don't pay attention to cold and flu as they think it is common in rains. They either neglect it or take medicines on their own. While minor illness are self-limiting and easy to control, prompt treatment and precautions should be taken to prevent complications. It is very necessary that you understand deeply what is viral fever and its insights, so that you are able to take care of yourself as well as your family. So we will give emphasis here on introduction to viral fever. Fever. Fever is defined as elevation in body's temperature more than normal in response to some pathological stimulus entered inside the body. Fever can be categorized as bacterial and viral. Now, as the name suggests, bacterial fever is caused by bacteria and viral fever is caused by viruses. Bacteria are single-celled organisms that thrive in many different types of environment. Some varieties live in extreme cold or extreme heat, while others make their home in people's intestines. Viruses are even smaller than bacteria and require living hosts such as people, plants, or animals to multiply. Otherwise, they are not able to survive. When a virus enters your body, it invades some of your cells and takes over the cell machinery, redirecting it to produce more virus. Now, let us know what viral fever actually is. In medical terms, any fever caused as a result of viral infection is a viral fever. The term encompasses a wide variety of viral infections which can be clearly identified by their symptoms and signs. These virus infections are more easily to be picked up in a person with low immune status. After entering the body, the virus replicates in the host DNA and finally spreads up locally and via bloodstream to various systems of body, thereby manifesting various signs and symptoms. It affects all age groups and occurs mainly in monsoons and winter season, but now is seen throughout the year. It usually lasts for 3 to 5 days and may extend up to weeks. Viral infections are highly contagious, so it spreads very rapidly. Most viral infections are spread through the inhalation of aerosolized particles, by intake of contaminated water or contaminated food, or by direct contact. Infection then spreads locally and thereafter into the bloodstream and lymph channels. Some viral infections are transmitted by direct inoculation into the bloodstream. The duration of primary infection may vary from days to several weeks. The disease is usually a consequence of virus multiplying at a specific site. Sometimes, even if the fever comes down, the virus continues to multiply and causes persistent infection. Once the virus enters the body, there is an incubation period when the virus multiplies to a higher level to cause infection. Usually, the first signs are chills. Another sign is 100° Fahrenheit to 103° Fahrenheit fever. One with viral fever would have pain throughout the body, especially in the back and in the legs. One may have one or more of the following symptoms: cough, sore throat, runny or congested nose, headache, chills, fatigue, nausea, vomiting, diarrhea, redness and burning in eyes, skin rashes. It is not essential that one will feel all the symptoms, but one or more of the symptoms would be certainly present. The diagnosis and management of viral fevers is based more on the clinical presentation than on the laboratory investigation. The diagnosis is made by the typical history of fever with severe muscle and joint pains. Skin rashes and lymph gland swellings have to be specifically looked for. Laboratory investigations are undertaken to rule out other bacterial infections such as typhoid. The number of lymphocytes may be increased in the blood count. Treatment of viral fever is purely symptomatic with antibiotic and analgesic drugs. Antivirals are prescribed. Antipyretics to reduce fever like ibuprofen and acetaminophen are prescribed. Patient is advised to take lot of fluids, healthy diet rich in vitamins. Only in cases of superinfection, antibiotics are need to be prescribed. It is important that antibiotics are not routinely used. Nasal decongestants are prescribed to relieve runny or congested nose. There are usually many side effects accompanied with the allopathic treatment. Let's have a look on the following side effects. The very first side effect is nausea. It usually occurs with such medications as aspirin and ibuprofen. With ibuprofen, this form of stomach upset may also cause vomiting. Drugs like ibuprofen can cause stomach, chest and throat pain. Breathing may be difficult and there also may be a rattling noise when breathing. These drugs may cause itchy skin that turns pale or a rash that includes raised or flat lesions. Use of drugs like oseltamivir may cause elevated liver enzymes. Use of antibiotics like amoxicillin causes gastrointestinal troubles and improper secretions of gastric juice. If you prefer taking allopathic treatment, here are 3 ways to support your system while on these chemical drugs. These drugs not only kills the bacteria causing sickness but also wipes out beneficial bacteria that contribute to a healthy digestive system. Therefore, taking probiotics like curd, yogurt can help you prevent gastrointestinal troubles. If you experience nausea, try sipping ginger tea to soothe your stomach. Another common complaint is diarrhea. which may be relieved by drinking raspberry tea. Taking antibiotics can tax your liver, which is responsible for breaking down the medications you ingest. Milk proves to be effective antioxidant on liver. We know the importance of curing the disease right from the root and not just provide symptomatic relief. In case of viral fever, it is very necessary to eradicate the viruses out from the body. If the virus is not taken out from body, it may again multiply whenever the body is in weaker state. Therefore, one may suffer frequent viral fevers. Yes, you have a way to cure yourself naturally and without any drugs. It is known that diseases start from auric body and then they enter physical body. Therefore, by cleaning the aura, you dig the root out and you are cured. Lately, a person came to PCTC suffering from viral fever. We advised them aura cleaning and healing. He took 3 sessions of aura cleaning and got completely cured. Even the fatigueness and lassitude from which he was suffering was completely eradicated. Pranic healing is another effective way to deal with viral conditions. It deals with filling up of etheric patches and thus one is completely renewed and refreshed. Lastly, according to the body conditions, we suggest a suitable home remedy to relieve the disease and remove the toxins out from the body. We know that one size doesn't fit all, so it's very necessary to check the person's condition and suggest them suitable remedy. We want you to stay healthy and happy always. So we present to you some self-care tips and steps to prevent yourself from viral fever. Try to avoid getting drenched in rains, and if it is unavoidable, wipe your head immediately. Keep yourself warm. Avoid eating out, especially the street food. Drink properly boiled water. Eat healthy, light and fresh food. Wash your hands regularly to avoid any sort of contamination or infection. If you get an infection, try to stay indoors to prevent spreading it. Use handkerchief to cover the mouth and nose while coughing or sneezing. Keep the surrounding environment clean. Use mask while you come in contact with someone who is suffering from viral fever. Cold sponging can be done to reduce the fever. Drink lots of fluids to prevent dehydration. Take healthy diet rich in vitamins. Take steam inhalation if you have blocked nose. I hope that you got enough information about what is viral fever and how can you prevent it. For more details, you can log on to our website healthforall.wix.com/pctc, or you can email us your queries and problems to write to pctc@gmail.com. You can also follow us on www.facebook.com/panaceacosmic, or you can contact us on the numbers on your screen. Thanks for watching. Enjoy great health. Bye bye.